and welcome to Badger Talks Quick Picks, which brings exciting happenings, resources, and talent from your UW flagship campus and to the people of Wisconsin and beyond. I'm Isabel Hernandez White from Madison, Wisconsin. I'm a senior. I'm getting a Bachelor of Arts in Psychology and Chicana Latine Studies. I am pleased to introduce Evelyn and Dr. Alisa Ramirez-Stegui. Today, the presenters will explore the development of Esperanza, nuestra cultura de salud, hope, our culture of health. The partnership also focuses on strengthening family-centered community programming that addresses the social determinants of health and promotes health equity. The braiding of community and university resources, funding, and program development to create and strengthen a sustainable, engaged partnership that centers liberation, anti-racism, and decolonizing mental health care for Latinas will also be discussed. Evelyn provides leadership for Esperanza, nuestra cultura de salud, a Wisconsin partnership program-funded community and academic partnership between Centro and UW School of Education Psychology programs. Esperanza's work is grounded on healing ethno and racial trauma and radical healing models. Evelyn has over 20 years of program development and implementation of local and statewide initiatives to improve working conditions and well-being of racial and ethnic minoritized populations in Wisconsin. Dr. Alisa Ramirez-Stegui is a counseling psychologist from Cholula, Puebla, Mexico, where she received her licenciatura, her bachelor's degree, in psychology at the Universidad de las Américas, Puebla. Alisa completed her graduate training at the University of Wisconsin-Madison and as a clinical assistant professor and director of Esperanza Bilingual Psychological Services Certificate. Alisa's work focuses on understanding and developing culturally affirming Latina-centered psychotherapeutic training and practices through liberationist, anti-racist, and decolonization frameworks that seek to integrate ancestral ways of knowing to strengthen Latina communities. Please welcome Evelyn and Alisa.
Thank you. Today we'll be talking about Braiding Esperanza or Hope, an example of sustainable engaged partnership to promote Latina mental health equity. My name again is Dr. Alisa Ramirez-Stegui.
I am Evelyn Cruz. Today we'll talk about Centro Hispano and the inception of Esperanza, the Esperanza Bilingual Psychological Services Certificate, and Braiding Esperanza in our sustainability plan for Esperanza. Centro Hispano's mission is empowering youth, strengthening families, and engaging the community in such a way that Latinx families can aspire upward to reach personal and professional goals while feeling engaged and strengthened with the tools for success. Centro Hispano's work is an ecological approach from the inside out. At the center is Centro and staff, then our programs that support youth, workforce development, and family support services. In the family support services, we have case management, both in Sun Prairie and in Madison, the ACA navigation, immigration services, and peer support services. To support workforce development, we have Camino Certified Peer Specialist, Caminos CNA, Caminos Finance, Caminos Progreso, Caminos Tech, and Latinas in Savings. To support youth, we have Juventud in the middle school, Escalera in the high school programs, Regeneración across the county, and Avanzando, a college transition program. The motivators for the Wisconsin Partnership Program grant that support Esperanza are related to injustices in the system towards the immigrant community. One of them is that Latinx communities have been under siege. There are family separation, children in cages, vigilantism, public policy of cruelty, racial profiling, and direct and vicarious trauma. Similarly, there are workforce shortage to address these issues. For every bilingual person that provides psychological services, there are 4,500 Spanish-speaking residents in the U.S. There are workforce limitations related to language preference of the providers, and that determines the language of the treatment. That implies oppression because Latinx clients receive services in the language of oppression or the oppressor. Also, their mental health treatment is verbal, special role of the language and mental health services. And it's best to provide services in the language of our feelings, which is Spanish. There's a lost opportunity because we can recruit bilingual students at the university and then only train them in English in order for them to provide services bilingually or in Spanish. Also, there are assimilation pressures for the Latine university students. There's little support in Latinx communities in Spanish.
In response to these issues, we have developed a bilingual psychological services certificate in partnership with Centro Hispano of Dane County. The goals of Esperanza are to increase access to culturally appropriate mental health services with training and intervention, and to also strengthen family-centered community programming that addresses the social determinants of health. So those are the conditions and the environments where people are born, where they live, learn, work, play, worship, and age, that all affect how they heal, how they access wellness, and how they thrive in their communities. Nuestra cultura de salud, or our culture of health, views health holistically, that through a framework that seeks to address the physical, psychological, social, environmental, political, and cultural factors that influence wellness. We are an innovative, justice-oriented community university partnership. On the community side, at Centro Hispano, we develop, implement, and evaluate programming that seeks to address these social determinants of health and to improve mental health, and do advocacy through local and state committees to facilitate systems change. On the academic side, at UW-Madison, Esperanza includes the bilingual Spanish-English clinical training certificate and research that supports the effectiveness of our work. Esperanza recruits currently enrolled Spanish-speaking graduate students across UW-Madison campus in any clinically based program, including psychology, social work, medicine, and public health. Graduate students who are also interested in taking the non-clinical courses are invited to contact me to enroll in Esperanza courses, as they provide a unique foundation in liberation psychology and decolonization frameworks. The Esperanza Graduate Certificate includes 5 courses, a total of 9 credits, that are offered on a 1.5-year academic schedule. And as part of this training program, graduate students can expect to build their knowledge grounded in liberation psychology and anti-racist and decolonization frameworks that ultimately promote radical healing for our Latina communities, to understand the principles of outreach, advocacy, and appropriate community university partnership, and to engage in culturally and linguistically affirming programming that promotes their own personal and professional wellness and capacity to thrive. The courses that we offer are in a format that slowly increases in the Spanish language demand to get students accustomed to using this language in an academic and clinical training setting. The first course, Radical Healing, provides the philosophical foundations of ethical and culturally affirming Latina bilingual training. The second course, Dimensions of Latino Mental Health, provides the theoretical foundations of effective clinical care for immigrant Spanish-speaking Latinas. The third course, Strengthening Latinas, is the practical, clinical, and interviewing skills foundation in Spanish, where students then put their theory into mock interview practice. And then the final courses over the next academic year are a 1-credit clinical supervision in Spanish that accompany students as they complete a clinical internship or practicum experience in the community, where they are expected to provide services in Spanish for at least 25% of their time, although we are very flexible around what that might look like. In the next section, we're going to discuss a new optional course that we have developed, again, in partnership with Centro Hispano, the Esperanza Community Engaged Research with Latinas course. Community engaged work is at the core of our work here in Esperanza. As discussed before, we conduct program planning and development, advocacy and systems change, bilingual training, and research. You can scan this QR code to look about a little bit more about information about our work. However, we really truly want to see and facilitate tangible change within our communities, which is why we have developed a course as a sustainable infrastructure for community and university partnership.
We will talk a little bit more about the Braiding Esperanza in our sustainability plans for our community engaged research course. So Esperanza has this community engaged course that we teach at Centro, and it's part of counseling psychology, Chicano, and Latinx studies. It allows for a one-door entrance to support students at Centro for this university community partnership. It also is being supported through a grant with the Mortgage Center, and it is intended for undergraduate as well as graduate students that seek to develop and implement community-engaged research and programming for Latina populations. The projects are based on projects that Centro is working with in the community. This community-engaged research course is a community-based learning that is taught with and at Centro. It's interdisciplinary because it draws on research and practice across education, psychology, and public health to disrupt, mitigate, and eliminate mental health disparities among our local Latina populations. It is taught throughout the full academic year. The fall, it focuses on project development, and during the spring, on project implementation and dissemination.
As part of this course, we are currently conducting an evaluation of the Momentos de Esperanza, or Moments of Hope, Spanglish podcast that was developed by our Esperanza team as a public health initiative to improve mental health literacy through different charlas or talks that are focused on wellness and mental health in the Latina community. As part of this course, again, we are also researching another example of our current projects is the research on the effectiveness of the Healing Ethno and Racial Trauma, or HEART, Sanctuary Program, or HEART Santuario, which is a collaboration with Despertar del Camino Sagrado, Reawakening the Sacred Ways, to implement a monthly Spanish-speaking group that brings together Latina and Latina serving mental health supports at different intersections. So people who may be working in the community, in school settings, in healthcare across Wisconsin and beyond, who are working with Latina communities directly to promote their own healing from ethno-racial trauma. This group is led by Indigenous elders who alternate between facilitating a workshop or taller that centers Indigenous wisdom and facilitating a dialogue circle where participants can deepen their understanding of these teachings. We believe that these are wonderful opportunities for students to put their research skills into actually applied practice and understanding what community-engaged research might look like. Multiple efforts that we have been able to fund the Esperanza partnership. Of note, Centro Hispano has committed fundraising to fund an Esperanza position that allows the continued collaboration and co-teaching from Centro staff with UW-Madison, again, as a way to make a sustainable effort of community university partnership. The inception of Esperanza was possible through a multi-year grant that was funded by the UW-Madison Wisconsin Partnership Program. This grant will be ending in 2024, and unfortunately, no other university programs have committed to the continued funding of Esperanza on the academic side. The Esperanza Community Engaged Research with Latinas course was developed through support and funding of the Mortgage Center, which provides continuous and sustainable funding for these types of service learning and community engaged courses across the UW-Madison campus. And our own program development, implementation, and evaluation is also funded through other county and statewide grants, for example, the Wisconsin Minority Health Program. Specific programs such as Heart Santuario will continue to search for grant and foundation money to support the continued implementation of these very helpful spaces that promote racial and ethnic healing, resistance, and reexistence.
We have been incredibly excited about this partnership with the University of Wisconsin-Madison psychology programs and Centro Hispano. And for the final reflections, Esperanza is an innovative community university, justice-oriented training and intervention model. It's not just what we do, but also how we are doing this work. The principles of mutuality ground our work: respect, resilience, reciprocity, and sustainability. We believe in the power of community to heal. This means that a large shift in university and community relationship that can transform everyone for the better, especially in this power sharing that we have had through this collaboration. And finally, we hope that the lessons learned can be helpful for many historically marginalized communities. Our liberation requires us to envision bold and joyous futures that can center our strengths. Thank you.
Please check out more information about our work at our website, esperanza.wisc.edu, or you can scan this QR code again to go to our website. Thank you so much.